We know that data in Toronto has painted a stark picture of how COVID-19 is disproportionately impacting people of color and in particular Black communities. Now the question is, when and how are governments planning to respond to these health inequities? The COVID-19 numbers released by Toronto Public Health recently show that 4 of the top 5 neighborhoods with the highest infection rates are each home to a population of over 60% visible minorities, most of them Black, while 4 of the 5 neighborhoods with the fewest case counts are less than 6% Black.
So the province needs to know who the people are at highest risk, and then it needs to work with those groups and those communities to try and work out how it can best protect them.
In comparing some of the neighborhoods, York University Heights has 20 times the rate of infection of the beaches. If you live in the Rexdale-Kipling area, you've been almost 11 times more likely to have COVID-19 than if you lived at Yonge and Eglinton.
That's not at all surprising to me.
According to Dr. McKenzie, during the H1N1 pandemic, Asians were between 3 to 6 times more likely to be infected, and Ontario's Black population was 10 times more likely than any other population, and more than a quarter of all influenza deaths came from the Indigenous population.
Ontario did at that time try and set up different strategies to try and protect the Indigenous population from flu. So this idea that we need to look at different populations and we need to have different responses for different populations is something that is normal in public health.
Which is why health equity experts and policy researchers were surprised the same hasn't been done during this even deadlier pandemic. Data collection, experts argue, can help to not only identify higher risk groups, but also advise government response.
It's quite important that any data that's collected is collected with the express consent of communities as to what you're going to do with the data.
The province is requiring all public health agencies to collect data which includes race and income. The Ministry of Health says it's working to crunch the numbers and will then determine how to communicate the information. With numbers already released in Toronto, we asked Minister Christine Elliott when we'll see the concrete policy changes to address the health disparities.
That is going to be entirely useful information, both in terms of short-term decisions that we will need to make on health, as well as longer-term decisions. So we've just started to collect that data now, but it is going to give us a lot of information on the changes that we should be making in the future.
On its part, Toronto Public Health says it will have a report on this data by the end of the month, saying the social determinants of health also require involvement from multiple sectors, including housing, childcare, and education. A group of experts have also called on governments to take a number of steps, including collecting general data on health disparities, not just COVID.
It's all about the fear of COVID. It's about not getting access to healthcare, and it's about the economic downturn. And all of those have an effect on health.
It's still unclear when we'll see this data released provincially, with the province only saying that they're expecting public health agencies to report the data within the next few days. In Toronto, I'm Faiza Amin for City News.